So anemia is really common in patients with gynecologic cancers. For a few reasons. These patients experience bleeding related to their tumors and surgery, and are also going through systemic treatments, which can affect their bone marrow. And we know that anemia can have significant impacts on patients' quality of life, mostly around fatigue, as well as the rate of needing blood transfusions, and in some cancer studies, even overall survival. And so this is something that's really important to patients. And a lot of these things we can't really control or modify. But iron deficiency and sort of nutritional causes of anemia is something that we can easily, help patients recover from or can modify. And so I really got excited about addressing these causes of anemia as a way to make our patients' lives better. It's really common. So anemia, when we perform studies, have shown that over 2/3 of patients with gynecologic cancers will have anemia within 6 months of their diagnosis. In our study here at Northwestern, we looked at patients with gynecologic cancers and anemia. Over 50% of those patients had iron deficiency, at least as one component of that anemia. And my personal belief on why it's often missed is that there's not a system in place that sort of helps us to remember to screen for these nutritional deficiencies. And so the idea of my project here is a workflow that really makes it automatic so that we know that these patients have iron deficiencies and we can treat it. We know that untreated anemia for patients on systemic treatment for gynecologic cancers can cause a couple of things. One is it increases the need for blood transfusions, which, while relatively safe, can cause volume disturbances. It's a limited resource and rare infection reactions to those. There can be, in severe cases, treatment delays related to anemia, so interruptions to chemotherapy. And we know that maintaining activity levels and being able to take care of oneself at home and all of that, which is an important quality of life thing, but also helps patients actually get through treatment safely. And I think that anemia contributes to all of those things, and it's one of the reasons why we think it's so important to address. With my partners, we've developed a quality improvement project with the aim of increasing the screening for nutritional causes of anemia like iron and vitamin B12 and treatment when indicated for patients with gynecologic cancers undergoing systemic therapies. And so we developed a process by which we've incorporated this workup, so additional lab tests for patients with anemia, into our EPIC treatment plans to make that an automated process every 3 cycles of treatment. And so for patients meeting criteria for iron or vitamin B12 deficiency, we are then offering those patients treatment with IV iron or PO vitamin B12 and monitoring how patients are maintaining their hemoglobin levels before the intervention and afterwards to understand the impact. The primary benefit we've seen is the ability for patients to maintain their hemoglobin levels at a higher level after we started this intervention. Those in the group after our intervention where we started giving patients IV iron have been able to maintain that higher hemoglobin level over time. So I'm really excited about looking at a subset of this population, which is patients getting neoadjuvant chemotherapy. And these patients are both dealing with chemotherapy, but also preparing for oftentimes a pretty big, morbid, radical surgery as part of their cancer treatment. There's a real benefit with regards to keeping their hemoglobin levels high going into surgery to decrease perioperative morbidity. And so I'm really excited now that we've been doing this project for a longer period of time to isolate out these patients getting neoadjuvant treatment and see what kind of impact we can make for this subpopulation. Fatigue-related quality of life is a really big issue for our patients. And so I'm really excited about these efforts we've made to address it.